All right, your kid's nose is running. You got the snot dripping down their face. I mean, if they're sneezing, maybe it's allergies. They got the watery eyes. They're just rubbing like crazy, but also they're coughing a bit. And you're thinking, okay, is it just allergies? Or is this something brewing? I mean, is there a fever, but they're a little, they're just not themselves. Because the last thing you want to do is wait too long and end up with a full-blown infection, right? Come on, parents, this is what we do. It's all day long. So here's what allergies actually look like. Here's the deal. Allergies are your kid's natural immune response, an immune system overreacting to something harmless, like pollen, pet dander, dust, mold, allergies, right? They're not sick, but their body thinks they are. So typical allergy signs are watery eyes and watery nose and runny nose, sneezing fits, particularly in the morning too, itchy, watery eyes, mild dry cough. Now, especially if like they got a drippy nose, they're gonna have a cough, right? No fever, and energy levels are usually normal. Now with kids, you gotta know your kid and your kid's own energy, right? Allergy symptoms tend to stick around days or even weeks, especially when the allergen is still there, which is kind of funny why we're doing this outside, because it's allergy season, right? Yeah, right? Now, they usually don't get worse. What an infection looks like, it's a bit different. Green or yellow mucus, especially if it's more than just a couple days. You'll know when they're blowing their nose, those chunks that come out. Fever, even if it's low grade. Fatigue, I mean, again, you know your own kids' energy levels. If they just want to sit, I mean, come on, they want to sit and play on their iPads anyway, but more than usual. Loss of appetite, you know, like for our son, like he eats like a horse, right? So if he's like, I don't want to eat, I'm good, I'm not hungry, that's important too. Wet, rattly, or persistent cough, you know it when you're starting to hear it from their chest. And then pain, especially around the sinuses, around the face, in the ears, that's an indication that an infection may be present. Here's your parenting checklist. Ready? Right up here. Is your child playful and eating? Probably still allergies. Are they cranky, irritable, sleepy, and not eating? Could be infection. Are their symptoms worse after being outside in the dusty areas or just with their auntie's cat? Probably allergies. Are they getting worse by the hour or new symptoms popping up? Probably an infection. No fever? Go more towards allergy. Fever over 100.4 for more than a day, have it checked out. And again, I'm a little bit weird on the whole fever thing. I believe fever is the way that your body's actually killing off infections. I mean, that's just what the purpose of it all. But again, there are certain levels to that too. You don't have to play doctor. You just have to spot the patterns. And remember, if you're unsure, that's what we're here for. We can help you figure out what's going on, support the immune system, but also refer out to some great people that we work with when you need a different level of care too. So, all right, next up, I'm going to be covering when it's okay to ride it out naturally and when you really should seek medical help. So, all right, stay tuned. We'll see you soon.